First of all, good morning. I'd like to welcome all the guests, presenters, and thanks to members for attending. Before we begin, just a couple of housekeeping issues. I would like to remind attendees to please make sure your phones and computers are on mute during this meeting. Please only unmute your device when presenting or reporting. Please also turn off any videos. If you have joined the meeting by both phone and computer, please be sure both devices are on mute unless speaking. Pursuant to TCA 8-44108, statewide and regional planning and policy council meetings will be open to the public and held via electronic means, aka conference call. The meeting is being recorded, and the recording will be posted to the department website within the next few days. Because of the sake of time, the commissioner has a meeting right behind this, so we're gonna kind of move the agenda around a little bit to make sure we get her before us as quickly as possible. So at this time, I would like to present, is Commissioner on the line now? Kirby?
I'm looking through. Evelyn, can you mute your computer, please?
Okay.
Hey, Kirby and Albert, this is Kurt. I think Commissioner was going to be able to join us around 10:10.
Oh, okay.
Okay. All right, so we'll until the commissioner joins, we'll continue to move forward with the agenda, and then we'll make adjustments as necessary.
Albert, sorry.
Yes.
Sorry to interrupt you. I'm just thinking about time. If you want, we can in the meantime, until Commissioner gets on the call, if you want to ask everyone to take the time to review those minutes that went through while I tally up. Lots of people have joined in the last 2 minutes, so just total who's all on the call.
Okay. All right. So please turn to the minutes from the last meeting, and we ask all council members and participants to please review those minutes. We'll be coming and asking for approval of those minutes in a few moments. We'll give you a couple of seconds to do that. And Carrie, you can make me aware if we got a quorum at this time so we can take the vote.
Yeah, I'll let you know in just a couple minutes. I don't think we're quite at a quorum yet, so we might have to just put that on hold. Thanks everyone for being patient. We have a new process, or a different process, I should say.
Yeah. While we're doing that, I'll just mention too, for all attendees, use the chat box feature on the WebEx. If anyone has called in rather than joining the call via computer, attendants can email Kirby Fry at kirby.fry@ten.gov to let her know that you are in attendance. You can do that during or after the end of this meeting.
Morning.
Good morning.
Good morning.
Went down to just taking a few minutes to review those minutes before I make sure we got a quorum before we call for the vote of approval. Ladies and gentlemen, we're waiting for the quorum before we can make the vote, just to make those members aware while we're on pause at this moment.
Hi, Mary Linden. Can you hear me?
Yes,
Are you serving as Jennifer Jones proxy today?
I am.
Okay, thank you. I just want to make sure I counted you correctly.
I'm actually on the call today, Kirby. This is Jennifer Jones.
There you are.
I've been usurped. Hi, Jennifer. Does that mean I have to stay quiet?
You
Never.
No, Mary Linda, you know you cannot stay quiet.
I know that.
Jennifer, good to have you. Good to see you.
They get you in the door with a free.
Yes. Oh, you need to.
Can everyone mute their mics? We hear someone talking. Can you please mute your mics? Thank you.
Amy, I have 28. Do you have 28? Actually, 29.
Kirby, I have a little less than that. I think I'm trying to go through here. But if that's what you have, I'm sure that's what it is.
Kirby, I have 29 as well.
Okay.
Okay, well, so Commissioner is supposed to be on the call in 2 minutes. This might take a little bit of time, so I wonder if we could just wait.
Hey Kirby, this is Kurt. Yeah, let's hold off, even though we have a quorum, let's hold off adopting the minutes until Commissioner can give her update and answer any questions, because she does have only
Sounds great.
a little time period to be with us.
Thanks for your patience, everyone.
And just as a reminder, let me also say any questions that the attendees and members may have for any presentation could be entered into the chat box feature. Submit those questions through the chat box, please, or email Kirby for a response.
Hey Albert, this is Kurt. I just want to clarify with you that we're meeting electronically today out of necessity because of the safety issue with the pandemic, right?
Right, that's correct.
Thank you. Hey, is it still icy
Thank
in
you,
Denver?
Kurt.
But,
It's thawed. it has thawed out. We have temperatures expected to be in the 50s today. So we got people
nice.
dancing in the street. You would think this was Louisiana.
Absolutely. Yeah, because is today Fat Tuesday? Is that right? All right.
No.
All right, I'm wrong. Will not be the first time or the last.
But Kurt, I will say I miss seeing you guys in person. So we look forward to the day we can all sit around the table in front of each other once again.
Absolutely.
Mhm.
And that's to that end, that's a discussion that Avis and you and the regional chairs will be having after this round regional meetings, statewide meetings are over, about how we conduct these council meetings going forward. So stay tuned for all of that, and want to thank everyone who, well, first of all, I want to thank Avis, Kirby, and Amy for all the work they've done behind the scenes to make these meetings possible electronically. But want to thank everyone for bearing with this process. We know it has not been easy, but we also do feel that we've had a lot of great participation and cooperation, and that everyone has been able to participate. So thank you so much. And I'll stop talking now.
And just a reminder for the members, we're waiting on the commissioner. She's tied up right now. Shouldn't be long. Please be patient.
Hello.
Hey, Kirby, I've got 29 also. So is 29 the number?
I have a lot more than that now. I'm counting through it.
Okay, I'm trying to count through too. Okay, thanks.
Good morning, Commissioner.
Good morning. How are you doing today?
Good, good. Let me do a brief introduction, Commissioner. You come right in.
Yes, sir.
I'd like to present to you guys, all of you know, the hardest working woman in the state, our Commissioner, Marie Williams.
Thank you so much. I would say the hardest working woman with all of the hardest working state employees in the state. We have a great team. I'm pretty sure that y'all been told I've got to be on another call with the governor's office at 10:30. So I won't get to stay on like I typically do to hear the report outs. I always enjoy those, but I will for sure read the minute and talk to the team about how the rest of the day goes. I see that you're going to get an update from our team on 988, which is fantastic. And I can't thank Ellen Wilbur and Tamho enough for what they've done to really lead that group in tandem with us. The big report out today, Chair Richardson, is this, our budget and what was included and what the governor's moving forward and what we'll be talking about next week in front of the Senate and the House committees. So I will go through this so everybody gets a chance to hear what actually got included. Obviously, our largest request was around the provider rate increases for substance use and mental health contracts. We got 17.9 million with that, broken down by the state rates, which is mental health had higher state dollars, so their rate is higher at 12.37, and substance abuse rate is at 5.6 million. So just wanted to share that with you guys. The second piece, which is really important, is the ability to expand substance abuse clinical treatment services. So that's another 6 million that will go to substance use providers. And so if you look at those two items together, that's almost 12 million that's going to go towards the substance use services in our state for treatment. Then you add on top of that the ARP, which is our addiction recovery program, the ARP, that's another million. So that brings that up to 13 million with substance abuse. And then you go to the Creating Jobs initiative. We're so excited about this. Our team, Mark Liverman, I see you, Mark, with the flag behind you. Mark and Matt and Rob Cotterman really worked hard on this proposal. As you know, it would give us $900,000, which would then be leveraged by DHS federal dollars that would allow us to serve in the first year an additional 742 individuals through our community providers, helping them get in jobs. So that is awesome. Then there was a grant that was added through the governor's office, which is the Morgan County Residential Recovery Court. That's another addition to substance use treatment dollars. That's 550,000, of which 200,000 is non-recurring and will go into capital maintenance projects that they have. So that brings us up to about 13.5 million with substance use programs, as well as the Creating Jobs initiative, which, as you guys know, also focuses on individuals that are dually diagnosed. And that's almost 4 million when you look at the drawdown from the federal dollars. Finally, what is in our state budget through state dollars is our IT support systems. Many of you work with our IT systems. You know, our crisis system, our 10 WITs, our safety net, all of those take a lot of work, as well as other systems that we use in our hospitals. And we're very grateful that we're going to have $520,000 to expand that group. I will tell you, we did an analysis and we actually were able to show that we are the lowest staffed per dollar per person with IT than any other department that we compared ourselves to in the social service field. So this is very much needed. So that winds up our state dollars, which is $26,965,700. Then you come down to the Tennessee Sports Gambling Fund, which that fund is actually not state dollars, but will be through the collections, as you guys know. That's another $1,225,000. That gives us total state dollar increase of $28,190,700. I will stop there before I go to the ARP dollars that are also being considered, and then the Moccasin Bend Mental Health Institute Fund. So does anybody have questions for me on what I just went over on the state funds? Okay, with no questions, I'll move on to ARP. We feel pretty strongly that we're going to get these dollars. As you guys know, we asked for these two projects in our state budget, but the governor is wanting to fund these through ARP. The first one is to expand our crisis continuum system. That would allow us to establish 3 new crisis stabilization units in areas that are in most need in our state. That is going to be an additional $34,919,000. Then the Project Rural Recovery expansion, hats off to Buffalo Valley, Debbie Hillen, as well as our friends at Helen Ross McNabb. I don't see anybody on here from there, but actually I see Candace. Candace, hey, hats off to y'all. And Jan, I think is also on here. Okay. Hats off to all of y'all for what you've done with the rural recovery. This will allow us $6.3 million to expand our mobile units. We'd like to expand to 2 additional mobile units through those funds. So when you look at the total state and ARP funding that we're looking at, that is a total of $41,219,716. Then you go to the Moccasin Bend Mental Health Institute rebuild. You will note that those dollars are actually in the F&A budget. Commissioner Ely is wanting to hold those dollars there while we finalize who might build the project and how we might move forward. So that request, which is being held, was $276,520,000. So guys, this is the largest budget that's ever been proposed by the governor of our state since the start of the department. And that totals $345,930,416. That's almost what we currently have in our whole budget. So anyway, we're very excited, very excited. I'm excited for y'all. I know that you'll be talking to your legislators. I mean, this is a huge, huge, huge budget that the governor's moving forward. So I will stop there and see if anyone has any questions or comments on the overall budget.
Commissioner, this is Ricky Harris. I just want to congratulate you and your team and thank you for your thoughtful consideration of all the things that this committee, this council puts on needs assessments. And again, as I've said in the past, we see the thread from the needs assessment to the funding proposals, and appreciate you and your team for that, and just grateful. So thank you.
Absolutely. Thank you, Ricky.
Commissioner, this is Kevin Wright from the Department of Human Services, Rehab Services.
Yes, sir. Hey, Kevin.
How are you?
How are you?
Good. I just wanted to say how excited we are to expand our partnership. We can make such a difference, and we're really excited to be able to partner, serve so many more people. Thank you for being a willing partner.
Absolutely. Thank you, Kevin. So appreciate your partnership. I know Mark sure does, for the day in and day out. And again, these dollars will go to the providers that are represented across the state that do this evidence-based individual placement and supports, and could not be happier. And I hope all of this gets approved by the legislature. All righty.
Commissioner, I'm sorry,
That's fine. Please go ahead.
this is Dawn Mitchell, and I wanted to say thank you for the community. I provide community-based services, and so thank you. Thank you for reaching statewide to provide services to all of our communities and helping them to become healthy and whole.
Absolutely. And Dawn, I so appreciate that. I'll tell you what, I just see that our fearless senator, Becky Massey, Senator Massey, I didn't see you when I was coming in. You know, guys, we don't get these funds without approval from the legislature. And Senator Massey has been a huge supporter of us. So Senator, let me ask you if you want to say or add anything, and I apologize. I didn't realize you were already here.
Well, I wasn't on at the beginning. I'm kind of in between appointments, so I wanted to pop on for just a little bit. But, you know, I mean, I echo, we have the most amazing commissioner of this, and she's, I mean, I think we need to get her a cheerleader outfit because she is a great cheerleader for all of the providers and the services across the state. And I love partnering with her to try to make a difference for our folks that need the help, whether it's short-term or long-term. And, you know, we all do know we've got lots of issues and lots of challenges, but the majority of your people that are on here are doing on the front lines every day, making a difference in Tennesseans' lives. So I applaud each of you all too. And however, I've always been an avid supporter of what we've tried to do here in the, you know, and for my part in the legislature. And I promise you I'll continue to advocate and do so and work with Commissioner Williams and all that she does. So thank you all.
Well, thank you. And Senator, if you could get a cheerleader outfit as well, you truly, if anybody has the pleasure to listen to her in committee meetings, you will know that she speaks from her heart and she is a true supporter of what we do. So thank you. Again, I'd like to just say thanks to my team. I wish I could stay on, Senator. I was just saying I've got to get on a meeting with the governor's office about a testing issue. And our Deputy Commissioner, Matt Yancey, y'all, Matt has been the one that really has behind the scenes pulled things together, gotten data together, given me what I needed to be able to actually advocate for what we do. Deputy Commissioner Yancey, anything you also would like to add?
Well, I mean, really the credit goes to our team. We've got some of the best assistant commissioners and directors and program staff in state government, each of which who I think this is not just a job, this is a passion. So many of our team members have personal experience with behavioral health issues, and this is their mission. So we're really fortunate to have the team that we do. Fortunate to have so many of the providers. We don't accomplish our mission without you. And Senator, I agree with you about Commissioner Williams. She is the best by far. So thanks, Commissioner.
Thank you, guys. Well, I hope you have a great rest of your meeting. I will see you in Chair.
Yes, ma'am.
Albert Richardson, I'll turn it back over to you, sir.
Thank you, Commissioner Williams. We salute the commissioner and her team and all the support. You know, we use the analogy of a football team. A quarterback can't be all that it can be, or he could be, or she could be, if they don't have a great offense and defense. And so, you know, we salute your team. We salute you for your efforts. I've been here almost 30 years and I hadn't seen a budget like this in 30 years. So, you know, we salute you and we thank you for all your efforts.
Thank you.
Sincerely. Thanks, Senator Massey, for all your support and your advocacy throughout this process.
The only thing I'm going to say, though, is we've got it this year. Let's all put it to great use. We don't know that we'll ever see another budget like this as far as the amount of increases and the amount of extra investments. So we need to, one, not get used to it. And, other than the things that are going into recurring, but really make good use of the one-time money that hopefully will save money for recurring for other things that we need down the road, because you just don't know what the next year's going to bring. The good thing is we're continuing to grow our base in Tennessee. We're continuing to grow our business and our tax base. That allows us to have extra funds to put back in the programs that are so important to us. So just use it judiciously, as I'm sure you will.
Thank you.
Absolutely.
Okay.
Up to, I got a 10:30 appointment waiting on me. Thank you, guys.
Okay, Senator Massey, have a good day. Okay, at this time, we'll turn to the minutes for members and those participants on the line today for review. At this time, Kerry, can you go through the members list, statewide council, who are present? And you guys will state your name and please say yes or no or abstain as whether you approve or not approve the minutes.
Sure, Albert, can you ask for a motion to to approve in a second first, and then I'll move in with that process?
Yes.
Okay, so we're good on the quorum, correct?
Oh, yeah.
Okay, so can I get a motion to approve the minutes?
So moved. Tim Perry, so moved.
Can I get a second?
Second, Debbie Hillen.
Okay, we have a first and a second. All in favor? Well, I'm sorry, we have a different process now, so Kirby will step in at this point.
Sure. Thank you, everyone, for being patient. I'm going to go through each of the members of the statewide council and ask you to please say yes, no, or abstain. Amy, if you don't mind keeping a tally for me to give at the end, that would be very helpful. Okay.
Sure, I can do that.
Thank you. Okay. Richard Barber.
Yes, approved. Yes, approved.
Thank you. Shara Biggs.
Yes, approved.
Yes, approved.
Amy, I think you might have to mute. I'm getting some feedback. Clark, do you mind muting?
Yeah,
Sorry. I'm getting some feedback. Okay. Dan Cagle.
Yes, approved.
Jeff Flayden. Jeff. Paul Fuchcar. Yes, no, or abstain.
Approve with gusto.
Thank you, Paul. Amber Hampton.
Approve.
Ben Harrington. I know you motioned, but
Approve.
Ricky Harris.
Yes.
Clark Harrison.
Approve.
Debbie Hillen.
Approved.
Kayla Jackson.
Yes.
Jennifer Jones.
Yes.
Deanna King.
Yes.
Wayne King.
Yes.
Eric Landry.
Yes.
Gail Lodato.
Yes.
Don Mitchell. Don Mitchell. Mary Neal.
Yes.
Mary Nell Osborne.
Yes.
Kim Parker.
Yes.
Tim Perry.
Yes.
Albert Richardson.
Yes.
Dina Savanas. No,
Yes.
Oh, you came through. I'm glad your microphone's working. Susan Seaborn. Susan Seaborn. Pam Sessions.
Yes.
Sam Slagle.
Yes.
Angie Thompson.
Yes.
Evelyn Jurgen.
Yes.
Jim Casey.
Yes.
Kurt Hippel.
Yes.
Elizabeth Jones.
Yes.
Debbie Miller.
Yes.
Brenna Morse.
Yes.
Steve Petty. Steve Petty. Don Watt. Don Watt. Okay, is there anyone on the call that is a member that I did not state your name to ask for a vote?
Daniel Ellis.
Okay,
Yes, or abstain. Abstain is fine.
so this is statewide members.
That is correct.
Thank you, though. I appreciate it.
And abstain. Thank you for all you do. Wonderful meeting.
Thank you. Amy, what is the total?
I have 30 yes.
Okay, thank you. I'll hand it over to you, Albert, to wrap it up.
The ayes have it. Motion carries. As have been approved. We'll go to reports at this time, starting with Region 1.
Thank you, Mr. Chair. Region 1 met by virtual means on Tuesday, February the 1st. There were approximately 24 in attendance. The minutes were approved. In the meeting, we discussed that we were still recruiting for applicants and we're looking for someone from our local universities to join the council to be able to give some school perspective to the meetings. Also, we'll be reaching out to our 2 behavioral health hospitals in our region about encouraging them to send representatives to the council meetings. The majority of the meeting was the discussion around the needs assessment. Both the adult and CNY subcommittees will have follow-up meetings to finalize the selection of needs to be presented to the full council for vote via email. There was discussion that some of the needs from the previous year may not have changed and would continue, including such things as housing needs, homelessness, workforce shortages, and adolescent substance abuse treatment needs. There were also reports from Lifeline and Regional Housing. We had a report from our crisis center that they were still very busy and seeing an increase the last few months in children's crisis. We also had a report from NAMI that they now have a full-time East Tennessee crisis intervention team for law enforcement training and resources, and that the Greenville City Police Department is engaged in forming a CIT program there, and that advocacy days will be on March the 1st and 2nd. We also had a report from Disability Rights that the children and youth teams were focusing efforts on doing investigations and monitoring in facilities. They would spend days in all regional mental health institutes and reporting back on any concerns that they were seeing regarding not meeting the needs and the rights of those with disabilities. There was a report from Frontier Health on receiving the Tennessee Resiliency Project grant to expand school-based services in the region and also to expand behavioral health integrated care into a couple of the primary care offices. Kirby was at the meeting and gave the department report and update. Our next meeting will be May the 10th, and that's the meeting for Region 1.
Thank you, sir. Region 2.
Hi, this is Mary Nell Osborne, and I am with Region 2. And our meeting is tomorrow. So we are having that agenda in mind. However, I have been hearing from most of the committees that they've already begun work on the needs assessment. As mentioned before, there continue to be pressing needs in housing, in homelessness, in services for adolescents, but also for children, mental health services for children in the state. So with that in mind, our report at this time is much more limited because we will be gathering tomorrow. Ben or Jan, do you have anything to add?
Nope, that sounds about right.
Okay, thank you.
Thank you. Region 3.
Hi, Deanna King with Region 3. We had our meeting in January and we're continuing to search for a secretary and hold elections for chair and vice chair with those terms ending. That is currently the main focus of our meetings, is trying to get our election seats filled. We had reports from our committees. Again, all of ours are focusing on getting the needs assessments completed. And then we also discussed how both of our committees, adult and children and adolescents, have done a much better job in reaching all of the 23 counties related to being virtual. We are experiencing a lack of hospital involvement. We understand that's related probably due to the pandemic and their focuses being elsewhere. So working to find representatives to join us for those meetings. Our next meeting is April 14th at 10 o'clock.
All right, thank you. Region 4.
Sorry about that. I can't ever find the unmute button. Region 4, we met on February 8th. And the primary focus was, of course, discussion of the needs assessment. The department did review with us the Open Meetings Act and highlighted the changes that we did implement around voting. The department also provided additional updates on the joint annual report, the public behavioral health workforce work group, and the Tennessee Recovery Navigators report. All information regarding website links were also shared with the council. We did receive an update from UHC, but neither of the other MCOs were present. Both the adult and the children's subcommittees had met prior to our council meeting to work on the needs assessment, and that information was provided to the full council for our discussion and identification of priorities. The legislative subcommittee also provided an update. They had met in December and are scheduled to meet again in May. Elliot provided several updates on several currently in process. And then we did finalize our meeting with a vote on a total of 6 priorities to start working on for the 2022 needs assessment.
Right. Thank you. Region 5.
Good morning.
Good morning.
Yes. I got this and one of the other budget and planning committees all mixed up. So I was like, okay, I don't have my minutes. So I am looking at the little chicken scratch that I did through the minutes. So we did meet on this past Thursday. We had a speaker, Tabitha Curtis, with the Tennessee Alliance for Drug Endangered Children. I heard her at a meeting that Commissioner Piercy had a panel discussion on last week. And I was intrigued because I didn't know about this particular group. So I had asked her to share information. She was actually in DC at a prevention conference, and she called in, and so she provided us with some information on child endangerment, drug endangered children. And if you're not familiar with it, I suggest that you seek her out. She's through the TBI office these days. The biggest part of our meeting was involved discussion on needs assessment. And there were a lot of discussion around those. Primary focus for the mental health ones was to focus on some affordable housing. And that's even addressing the fact that someone may be in housing, but with the rising cost of housing, can they afford to live there anymore? And what does that happen? Then what happens to them? The other focus was on looking at having acute treatment for those hard to place youth. And then CSU. So it was good to hear more about that today. On the substance abuse side, something that I deal with every day here recently, and that's workforce development. The second was to increase access to MMWM, medically monitored withdrawal management. It used to be the old MMCD funds, and treatment where can't ever meet the need, but to open up some of the avenues. A lot of the funding, and we've been blessed with additional funding, but you really got to fit. You can't always put a round peg in a square hole. And when you get federal dollars, they tell you who you're going to serve and so forth. And this is to look at some state dollars that would open that up. And again, that falls a lot in line with the budget. And then, and for the MMWM, there's only 4 ways to access that money. And to be able to open that avenue up where some other agencies could refer. The other is MAD housing for those in medication assisted treatment. There was a lot of discussion. These were voted on as the priorities. Amber and I will be writing these out. We'll send them back out. It was voted on to accept these. And we'll send them back out March 15th for final look at and comment, and send them into Avis Kirby by the 30th. We too have been looking for a secretary, and we did discuss that, and elections coming up at the next meeting. Kirby did the report from the department, and our next meeting is May 3rd.
All right, thank you. Region 6.
Good morning, everybody. I'm Richard Barber with Region 6. We met January the 11th via WebEx. We had 17 members in attendance. A big part of the meeting focused on the Family Opportunities Act, which was a result of the TANF funding, the $750 million TANF funding at the Department of Human Services. Matt Marshall, who is the CEO of the United Way of West Tennessee, is one of the hubs for the West Tennessee proposal. And he explained that, that each grant division was eligible for 2 $25 million grants. And he kind of walked us through the process of how we're moving away from silos and moving into collective impacts. And some of the things we wanted to focus on for West Tennessee were unemployment, stagnant population growth, poverty, health and education, and inside of that, focus on child care, food, and housing. Came up with the DREAM program, as it be called, and we'll move forward. We've got through the first phase of that. There were 17 applicants, and the West Tennessee proposal was one of 3 that was accepted in West Tennessee. That was exciting news for our region. Then Kirby presented the department report and kind of reviewed the needs assessment process with us. To note there was that the needs assessment, both for mental health and substance abuse, could go from 2 to 6. I think we all know historically it's been 2 for each. We had reports by the Children's Committee and the Adult Committee. Then we had a report where Chi 2 Housing is going into counties and doing lunch and learns try to promote the G2 housing for the different counties. And we had conversations around child advocacy days with the Children's Committee. And then we talked about the Day of Hope for Madison County on March 10th. And our next meeting is April 12th. Can't wait to see you all again. Thanks.
Thank you, Richard. Region 7.
Yeah, this is Mary Neal. I'm with Region 7. We just met Tuesday, January 25th at 11:30. Kirby gave our department updates. We had a presentation. Erin Gillian, who's the Region 7 Regional Housing Facilitator with the Creating Homes Initiative, she gave a very thorough presentation on their project. Like most of you have said, the majority of our meeting was dedicated to the 2022 needs assessment. Our committee chairs headed those discussions. We all met together in a group on Microsoft Teams and are still continuing those conversations. We're meeting again on April 26th at 11:30.
Okay, thank you. Adult Committee.
Hi, good morning. This is Ginger, and the Adult Committee met via phone conference call in January, and we focused the total session on developing our needs assessment for our mental health and substance use needs. And a lot of our focus was on housing, both bricks and mortar and supports for housing. Because our next meeting is after the due date for the needs assessment, we'll be meeting through email meetings and getting feedback from each other, and hopefully get that all turned in on time to Ms. Kirby. Thank you.
Thank you. Children Committee.
Hi, this is Lindsay Blevins with the Children's Committee. I know Ricky's on the line as well, but I think she's driving. So we met the Children's Committee last week, Wednesday, February the 3rd. We had 20 people on the line, 8 of those being from the state and the rest from the community. We devoted our entire time talking about the needs assessment. So we reviewed last year's needs assessment and then had discussion about what we wanted to put on our needs assessment for this upcoming year. So we had lots of conversations about what we wanted to keep on there, similar to last year, and things that we wanted to add. So we're going to be following up with our members via email after we get everything documented so we can have a vote on what to submit, because we're not going to meet again until after everything is due. And that's all I have.
Okay, thank you. Consumer Advisory Board.
Thank you, Albert. Good morning, everyone. I'm Dina Savanos. I'm the CAB chair, and the Consumer Advisory Board meets the first Friday of every month virtually, and we'd like to report that we decided to focus on the needs assessment, like so many of you, and the regional policy and planning updates instead of having resource speakers for the last few months. And we were so inspired by the sharing of recovery stories from the following. In January, we had Amy Bechtel. She's a CPRS and the faith-based community coordinator in the West. And in February, on the 4th, just last Friday, we had John Coleman. He's a spiritual life coach. And we continue to set aside time each month to share our wellness tips and support one another, asking questions this time such as, what are you most passionate about and what motivates you and what do you do to stay positive? And we enjoy monthly updates from the Young Adult Leadership Council, the CPRS program, my team of peer wellness coaches, My Health, My Choice, My Life, and the Tennessee Association of Peer Specialists, as well as conference planning and other business matters. The Zoom link, if you're interested in joining us, can always be found on the tn.gov webpage for the Consumer Advisory Board. And planning for the CPRS conference is underway this year. We are renaming it the Peer Recovery Conference. This is in order to be more inclusive of peers who haven't yet achieved their CPRS status, or they may be working towards it, or they may be supporters. And you can let me or Michelle Webster know if you'd like to participate in the planning. And we're planning on a virtual conference one more time this year in October. And finally, we have several membership openings. We have one in Region 1 for a person with lived experience in substance use disorder. We have one in Region 2 for a person with lived experience in substance use disorder, and one for a person with lived experience in mental illness. In Region 4, we have one opening for a person with lived experience in mental illness and one for a person with lived experience in substance use disorder. And in Region 5, we have one opening for a person with lived experience in substance use disorder and one for a person with lived experience in mental illness. If you or someone you know is interested in becoming a member, for maybe joining us for a monthly meeting, or if you'd like more information about the CAB, please contact me anytime at csavanos@tamho.org, or you can reach out to Kathy Haley or Michelle Webster. Our next meeting is going to be Friday, March the 4th from 9 a.m. to 11 Central Time. And you're so welcome. We hope to see you there. And thank you so much.
Thank you, Dana. At this time, we're going to have our presenters. Tennessee National Suicide Prevention Lifeline, abbreviation NSP.
Albert?
Yes.
There's also the Planning and Budget Committee. One more report.
I'm sorry, I did not see that on my, okay.
It's okay.
Okay, and that's the Planning and Budget Committee?
Yes.
All right. Ben, I apologize.
I was hoping to be off the hook. How about that? So the Planning and Budget Committee is the committee with the most fun of any committee on the State Planning Council. So I can tell you, we met in December and reviewed the commissioner's proposed budget. We also discussed then the annual report and the 3-year plan. And then we met again earlier this month where we reviewed what was in the governor's state address and our budget. We won't meet again until May when we get down to really all the good stuff, the fun stuff, the most fun stuff. And that's reviewing all the needs assessment recommendations that will come from each region. And so I need to do my subtle pitch and remind folks, you get a few more opportunities to recommend some needs this year than in prior years. We increased the number of recommendations to make. And then what the committee will do is it will take a long look at all the recommendations from each region and kind of synthesize them into, well, there are 5 regions that are saying, you know, expand this level of services, that sort of thing. And then we'll make our committee recommendations to executive committee and pass those to the commissioner. So I hope in this year where we've seen so many additions to the departmental funding continuum with the governor's budget and new resources being put in place, I hope you see the value and importance of all your hard work in the needs assessment process. We couldn't be enjoying what we're hearing about from the commissioner today, and hopefully the legislators will approve. We couldn't have that without your hard work way upstream doing the needs assessment. So kudos to y'all. Thank you for your hard work, and we look forward to reviewing it in May.
All right, thanks, Ben.
Sir.
Okay, and this time we'll go to our presenters. The Tennessee National Suicide Prevention Lifeline, NSPL 988 Planning Initiative will be presented by Jennifer Armstrong, Director of Office of Crisis Services, Suicide Prevention, Mental Health, Disaster, Tennessee Department of Mental Health and Substance Abuse Services, Division of Mental Health Services. And also our distinguished Deputy Commissioner Matt Yancey on Behavioral Health Community Programs. Can you guys come forth?
We are here. We have come forth.
Do you need me to share the presentation or do you want to share it?
You know, Kirby, is probably a safer bet if you do.
Okay, hold on one second. Just tell me when you need me to switch the screens.
Let's do it.
All right, 1 second.
And while you're doing that, I do want to underscore Ben's comments about the needs assessment process and everyone's involvement in that. He is absolutely right. We pay close attention to the needs that are being identified by the various committees and the local regional planning and policy councils, and they really do drive decision-making and budget requests. So know that your voice continues to be heard and your perspective is really taken heed of. And I think that's evidenced in our budget request for this year and in previous years. So really appreciate each of you and what you do on the needs assessment front. It goes a long way. So I want to jump into the discussion around 988. This is a big deal. So probably most people are aware back in 2020, Congress designated the new 988 dialing code to be operated through the existing National Suicide Prevention Lifeline. And if you're not familiar with the National Suicide Prevention Lifeline, it is a national network of over 180 independent crisis centers across the country that work and help people who are experiencing crisis, emotional distress, suicidality. It's been around, I believe, since 2005, and it has done a lot of great work saving lives. Historically, the number for the National Suicide Prevention Lifeline has been 1-800-273-8255. But beginning this summer, July 16th, as a matter of fact, that number will be converted to a much easier to remember number, a 3-digit number, that being 988. SAMHSA, which most of you know, the Substance Abuse and Mental Health Services Administration, is the lead federal agency on the conversion to 988. The Federal Communications Commission has been very involved on the federal level, as has the Department of Veterans Affairs. Vibrant Health, based out of New York, has been the federal contractor since 2005 to support the National Suicide Prevention Lifeline. And those entities, in partnership with the state behavioral health authorities, including Tennessee, and the Lifeline call centers, have been working very closely in collaboration over the past year or two in anticipation of July of this year for 988. I will say that SAMHSA, and in our conversations with SAMHSA leadership, I think they see this as a transformative thing for the behavioral health system in our country. And they liken it to the changes to the emergency medical services arena with 911 many years ago. They think this is going to be the proverbial game changer. So what we wanted to do this morning, and Kirby, I guess we'll go to the next slide, is bring people up to speed on where we are in Tennessee. This is a map of the Tennessee crisis continuum. And I will say one of the things that I've been reminded of over the past couple of years, working with people in anticipation of 988, is that we have a lot to be proud of in Tennessee related to the crisis continuum. SAMHSA a couple of years ago released a national guideline for behavioral health crisis care. It's a best practice toolkit, if you will. And really the purpose of that toolkit was to define national guidelines in crisis care. And when it came out, I remember going through the toolkit and thinking to myself, Tennessee is in a really good place because so many of the best practices we already have in place. So as you are aware, we have crisis call centers throughout the state. We have mobile crisis services statewide. We have crisis walk-in centers, crisis stabilization units. We have crisis respite services. We are in a really good place, infrastructure-wise, provider-wise, to get ready for what people are predicting to be a greater influx of people calling the National Suicide Prevention Lifeline, who may warrant downstream support, whether it be mobile crisis dispatch or a visit to a crisis stabilization unit. You can see here on the map the providers that make up the mobile crisis system in the state. Many of those same providers also offer CSUs. As the commissioner mentioned, we do have a pending proposal through the state's ARP funds to expand the number of CSUs by 3, which is a big deal because we're covering areas or hope to cover areas that have historically been underserved with CSU care. We'll go to the next slide. So Tennessee's front doors, I think this is an important piece of information. You can see there's a few ways that people initiate crisis services here in the state. The first of which is the statewide crisis line, 855 Crisis 1. You can see that in FY21, there were over 16,000 calls to that statewide number. Second to that are the local crisis call centers, the local crisis providers and the calls that they receive. The bulk of the crisis calls in the state are going to the 13 agency level lines, over 112,000 in FY21. And then pertinent to the discussion today, you can see over 30,000 originated through the National Suicide Prevention Line, which will be, again, transitioning to 988 this summer. Next slide. And I think this is where I'll turn it over to our crisis director. I think most of you are familiar with Jennifer Armstrong. She joined our department, I think, February of 2020. And her joining the department was really serendipitous because Jennifer has worked with the National Suicide Prevention Lifeline for many years. In her work at Centerstone, she worked nationally supporting call centers. And Jennifer has just been really helpful in guiding our thinking as far as how to prepare for 988 this summer. So Jennifer, I'm going to turn it over to you to talk about the current NSPL system and then finish the remainder of the presentation talking about what we've done here recently to bolster this system in anticipation of July 16th and where we're looking to go. So Jennifer, I'm turning it over to you.
Thank you, Matt. Thanks everybody so much for having us. I'm so excited to talk about 988 and what it means for our state. I feel like several of you on this call could do this presentation for us and with us. And so I really want to give a shout out to, I see Ben on here, Jeff Flade, and I saw Ellen earlier, and probably I'm missing a few, but have been very, very, very involved, not only in the planning and preparation, but helping us to think through implications for our crisis continuum. So thank you again. As Matt said, we do have multiple front doors in terms of accessing the crisis continuum, but I wanted to emphasize before we talk specifically to NSPL, the scope of the work, no matter what number you call, really truly is the same. We want Tennesseans to be able to define their own crisis. And so every crisis call should be answered by a trained clinician or volunteer that triages, provides something as simple as consultation on some occasions, a potential referral into higher level care such as mobile crisis, and sometimes even dispatches rescue efforts. So all of our front doors already work very collaboratively with 911, which is amazing. So as Matt said, we are really poised and teed up in terms of the scope of the work and the infrastructure we have in place based on current volume and into our state. So the way that Tennessee, that the Lifeline network is set up, every county in Tennessee, and this is not like it, there are some states where there is no in-state coverage at all. We are blessed in our state to have not only primary coverage for every single county in Tennessee, but also backup coverage. Each of our 6 centers, which are outlined here, we work with Family and Children's Services, Frontier, Centerstone, Memphis Crisis Center, Oak Ridge, Contact Care, and Volunteer in providing these services. And each of those organizations or crisis centers are assigned a primary coverage area and also a backup coverage area. And so it's it truly is a partnership across all 6. If a call goes to the primary center and it's not answered within a certain amount of time, the national standard is average speed of answer of 30 seconds or less. It will roll to then the designated backup center. If it's not answered within the designated period, it does roll out to a national backup center. So all that to say, as we think for the implications of potential increase in volume, all those calls are going to be answered, but our goal is to have them answered in our state. Next slide, please. I wanted to speak to historical efforts in formally supporting this network, and then hopeful plans for the future and continue to build out and support this work. I did want to say, and those of you that are on the call that have provided this work, these 6 call centers have provided the service for decades for literally free. I mean, next to nothing. And I mean, maybe based on level of service, it could be anywhere from $1,500 a year to, I believe, $2,500 a year. So as you all know, that is not at all provide them the ability to sustain services, and they have somehow done it again for decades. So wanted to give them a real big shout out there. Matt said serendipitous earlier, but when I think about the next 2 slides, I really do feel like what's come across in terms of funding opportunities to support this network has really leveraged us and prepare us for July, with the first being the Lifeline Capacity Building Grant. It was funded from October 1st, 2019 to September 30th of 2021. And this is the first time that we as a department were able to formally support the network with very little funding. But the goal here was, for us anyway, was to identify where we could enhance capacity in a way that was sustainable, but also use that funding as a time to collect really good intel around, FTEs, how many FTEs, what does it take to support X amount of calls? What came out of that was an 8% answer rate increase. I will say this funding was not enough to add, many staff at all. But what it did afford us was to move staff around to look at our in-state routing plan. I'll tell you, the last time that we as a state looked at this was 2014, and I think several of us were on that call. And there really wasn't a method in terms of how Vibrant was routing those calls. And so what we really used this opportunity to do was align counties with those local services. So for example, our crisis providers became primary for their mobile crisis catchment area, with the hopes that every caller experiences a 1-call resolution when possible and gets connected to local communities. Again, that we were met with great success there, from 59% in-state answer rate to 67%. Then along came, as we heard more and more about 988 going live July of this year, we were able to apply for what was called the 988 planning grant. This was also Vibrant funded. And as Matt mentioned, Vibrant is funded through SANS to provide the back office support, the admin oversight, and they really do oversee the routing platform and provide technical assistance and consultation with the centers. We partnered with Ellen, with TAMHO to help us implement this. It involved several different things. All of our call centers were provided a stipend to assist with some data collection to help inform where we are right now with capacity. It also afforded the ability to create our statewide planning coalition, which I know many of you on this call were on, and we're so grateful there. And the ultimate result of that group, which we will not continue, we will continue to resume even after this grant is over, which it actually ended. We will continue to convene quarterly, I believe, Alan. But we're really excited. We completed and submitted our implementation plan, which I think through the next slide, you'll be able to see how we're using funding to inform and best prepare. We can go ahead and go to the next slide. And so kind of on the, I guess in the midst of the teeing up to get ready for the planning grant, we were allowed the opportunity to potentially use the block grant 5% crisis set aside for this work. And thankfully, Commissioner agreed that this was where we needed to invest those dollars. This is recurring funding to the tune of $687,000. So we were very excited to enhance our infrastructure even more. So the goal of what we're calling the infrastructure enhancement pilot is kind of twofold. It is to get us right-sized based on current volume, because we don't know the level of increase post July 21 or 2022, but what we do know is what's currently coming to Tennessee. The second part of that is, there have been questions around, well, what are the implications of our downstream to our downstream crisis continuum? Historically, we have not collected, or because we haven't been able to fund or support, we have not been able to collect what we're called crisis call disposition data that really does speak to, for example, percentage of those calls that result in mobile crisis referral. So that this project has allowed us to do that. This went live. This went live August 1st, actually, so very recently, with the expectation that our call centers were going to have staff trained and in place based on areas of highest volume. We created a model for the work. We did kind of realign some routing again. We meet monthly with those crisis centers, and we are truly calling this a pilot, because by July 1, we want to be as right-sized as possible to hopefully exceed 90%. And I think that we're in a really good place to do that. As of November 1st, again, the staff were in place and data collection efforts began. We'll have our first quarter data, I guess, next month. We're really excited to look at that. I think that will help us better prepare for what may happen downstream once 988 goes live. Really excited about the results. And I know this is only 2 months, and with the caveat that, I know many of you have heard of workforce shortage struggles with our providers across the state. I will say that as part of this, there's one provider, for example, that had filled all the positions for this. Then, because of mobile crisis shortages, had to move some things around, so is now working to fill those holes. But this increase of 17% in 2 months is even with staff shortages and vacancies. So I'm really excited to see what the impact will be once we're fully staffed across all 6. But if you look at where we were, I believe the slide before is 59% to 84%. That's 25% increase. And that's huge. So we're very excited. We're 84% now, again, with staff as of last month with staff shortages. So we're only 6% away from being meeting the national standard. So we're in really good shape. Next slide. So future efforts. I'm sure everyone's heard about the most recent SAMHSA notice of funding, which for our state, based on average presenting number of calls to Tennessee, equated to $1.688 million across 2 years. I think when we're writing the application, I feel like the work that we're already doing through the pilot is so similar. So that's great that we already have used the set aside funding to create our model and set our goals in terms of capacity and data collection. But this will further enhance the infrastructure within our crisis call centers. But where it's different and we're really excited about is we're going to begin to build out chat text infrastructure in our state. As you all know, there are many youth and young adults, or in general, that aren't really willing to pick up the phone, but are willing to send a chat or a text. And in looking at the distribution for our state and working with Vibrant, if you look at what we're calling total contacts, 98 contacts, about 60% of that makes up the call volume. About 40% of that makes up the chat and text volume. So we really wanted to use this funding to start to build that infrastructure out in a thoughtful way, to give us time over the next 2 years to really collect our own in-state data to inform what are we going to need in the future, what should we pursue in the future, to really right size that side of the house, specific to those reaching out via chat and text. So we are working with one of our providers, Contact Care out of Oak Ridge, who has for years been a national chat tech center, who they have agreed to be our 24/7 pilot site, which is amazing. We're so grateful for them to do that. We have 2 others in our back pocket that are also part of the crisis call side for 988. That would be Family and Children's Services in Centerstone, that are already certified, like Oak Ridge as a chat and text center, already have the platform in place, but merely does not have the funding and has not historically to build out capacity via staff to manage that. So we're really excited to be able to slowly build that out in a strategic way, but also even bolster further our crisis call centers. We're proposing 85% of that total funding to give directly to the Centers for Infrastructure Enhancement. And then as 15%, we're going to be hiring a full-time project director and partner on for some evaluation support. One thing, kind of an add-on that I'm really excited about is we know and we've heard anecdotally the impact that true robust crisis triage can have in terms of diversion and recidivism. And so part of the evaluation here is going to be measuring impact of crisis triage and what processes are in place within that, and provide training to our clinicians and measure pre and post. So we're really excited about that. As we've seen this thing unfold, we know that this is only going to grow in terms of nationally and at a state level, and we really want to have a full-time person to be able to keep their eyes and ears on 988 and kind of help us navigate through this moving forward. The grant period for this will begin, if awarded, will begin in April 30th of 22 and will end the end of April of 2024. And I believe, Matt, we will hear back beginning of April. We're not very concerned about the ability just to hit the ground running, just simply because we already have this infrastructure in place. So we feel that we can get a move on pretty quickly.
Yeah, and Jennifer, I would just add, because I know many of you have been paying close attention to this topic on the national level, and this award here comes out of the $250 million budget that SAMHSA set aside for 988. I think maybe 188 of it is going to Vibrant to help further their work with national backup centers, but the remainder of that funding is going to the local states. And in keeping with how we traditionally operate with our grants, the vast majority of the dollars, once awarded, and I feel confident will be awarded, we're going to put into the call centers to continue to help build out their infrastructure, which we've been doing over the past couple of years.
Thank you. Next slide. And then in terms of just future ongoing efforts as we prepare, we are going to kind of follow in suit with what our federal partners are going to do in terms of marketing. So we will be working with our communications director and all of our community stakeholders to start thinking through that marketing plan to begin in 2023. As I mentioned earlier, we're going to continue to have quarterly 988 Planning Coalition meetings to get valuable impacts and feedback in terms of how we need to continue to roll this out. We will continue to use our own center reported volume increase and impact data to evaluate where our capacity gaps may be or where they may not be. And then we will continue to use data to evaluate our downstream impact of current volume and then and potential increase in volume that may have on our system. And I believe that's it.
Yeah, and Jennifer, I would just add, this is a big deal. I think it's going to be a lot easier for people to remember a 3-digit number like 988 than a 10-digit number. And again, I can't say enough great things about Jennifer and her entire team. Joanne Purley's been very involved with this. I feel like we are in a really good position. And just thanks to Jennifer and our crisis team, and also to the 988 Planning Coalition. They've been very helpful in working with our department as we think through next steps. So a big thanks to all that have been involved up to this point. Thank you, Albert. And we'll be happy to answer any questions that folks may have.
Thank you, Deputy Commissioner Yancey and Jennifer, for that presentation. It will have a significant impact on the citizens of this state, and we look forward to the operation of it. And we got the right people at the helm. Jennifer, look like you're on point. We appreciate you. And thanks, Deputy Commissioner Yancey. Any questions?
Jennifer's a rock star. Just wanted the council to know.
That wasn't a question, Ron.
Okay.
But she's awesome.
Okay, so if we have any questions that you hadn't asked, please put in the chat box or email to Kirby, and she'll get that information back to you or response. We'll move on. Collegiate Recovery Initiative. Nathan Payne, Director of Collegiate Recovery Initiative.
All right.
Do you want me to share, Nathan, or do you want to share?
I think that I can figure out the share thing. Let's
Okay.
give it a shot here.
Might be easier.
I've never do what?
Nathan, while you're doing that, let me tee this up for folks, because I just now realize that I don't know if you've got a proper introduction. So over the past couple of years, our department has really looked to partner with colleges and universities around recovery. And a lot of this work has fallen under Monty Burks and Nathan Payne, who you guys are in for a treat this afternoon. I've learned so much from Nathan over the past year as it relates to what important role colleges and universities can play in helping advance recovery for students who may be dealing with mental health and substance use issues. And this initiative, the Tennessee Collegiate Recovery Initiative, continues to grow. And I know Nathan's going to talk more in depth about the universities and colleges that we're working with, what that partnership looks like, and what our vision is to better support what is pretty much a young adult population, which I know we've talked about before in these meetings, is a population that really warrants all of our attention as it relates to behavioral health. So, Nathan, I just wanted to tee it up for you. You are doing excellent work, and we're just thrilled that you are serving as our Director of Collegiate Recovery. So,
Sweet. I appreciate that tee up. Hopefully I can follow through with a swing. Yeah, so I appreciate that. My name is Nathan Payne. I'm the Director of Collegiate Recovery, and I am excited to be on here with you guys. I really appreciate the opportunity to talk about this initiative. I had my camera off for so long, it's like the moment of truth. You have your camera off in a Zoom meeting and you turn it on and your hair's all like wackadoo and you got coffee in your mustache. But I think I got everything worked out. No, I really appreciate the opportunity. I really appreciate being asked to share about this work with you guys. This has been like a really formal and professional meeting, so I feel super legit sitting in on it. I'm excited to share about my passion, because that's what this initiative is, and I want to kick it back to Commissioner Yancey just in giving him a nod in recognizing that passion, and the department as a whole, and Monty and Commissioner Williams. This is something that I approached them with a couple of years ago, and I just really had a heart for this work, and they have supported me like throughout the whole thing, and it means the world to me. And furthermore, like more importantly, it means a lot to the students that are being reached and helped by this initiative. So I'll just go ahead and roll on with the, all right. So one of the things that we're trying to do with the Tennessee Collegiate Recovery Initiative is just simply engage campuses, engage them in being greater allies to their students that are struggling with substance use or mental health. And really this all came about from my own experience. I'm a person in long-term recovery. October 31st, 2012 is my recovery date, or is my sobriety date. I got spooked into getting clean. You guys will get that going home. That's one of the bad things about these meetings. You can make a joke and you don't hear anybody laugh. It's really made me question whether or not I'm funny. But it's October 31st, it's Halloween. Yes. Can we do that? I saw the chat thing. Matt Perriott is going to get me a little sitcom track where we have a little laugh, a little audience participation. No, I see all the emojis coming in. I really appreciate it. But that's my sobriety date. So I'm a person in long-term recovery, and since entering recovery, I became a person in long-term college as well. I'm hoping to get out of that soon enough. I'll actually be graduating this May with my graduate degree in clinical mental health counseling. But when I got started in college, I noticed that there really weren't a lot of resources available for students, and there really wasn't a conversation being had on campus, and that was surprising to me. I remember going into my advisor's office and disclosing with her that I was in recovery, and she was there to support me, but there was not really any there were no resources that she could give me. There were no resources to support me. She offered her support, and I'm still very thankful for that lady today. She still sends me messages on Facebook and comments on my posts and stuff about how proud of me she is. But it really it fired me up, and once I get a fire under me, it's kind of hard to put it out. And it made me want to pursue the conversations on campus in a greater capacity. And like I said, the department has been behind me 100% the whole way, and I'm very grateful for that. So starting out is just raising awareness on campus, and coming in and facilitating these conversations. Because the biggest thing about substance use and mental health and suicidal ideations and all of these things that we all work so closely with on a daily basis, and I know I'm not going to be saying anything here that's new to you all. But the biggest thing that I notice is that these conversations are so difficult to have, and very difficult to have in a genuine and raw fashion. And I think that that's the way that we need to be having these conversations. We need to be taking a moment to step out and say, this is an issue. How do we talk about it? And I think that part of why they're difficult is because it's such an intimate thing for so many people. Everybody is so closely connected to these issues that we all face in the state of Tennessee. There's pain. There's so much tied into these topics that any array of emotions can get brought up in a conversation. And so I think that with that, the easier approach, the easier, softer way, if you will, is to just sort of not have them and expect that somebody else will take up the torch and have these conversations. But that often does not happen. So that's part of why awareness is the first step in the Collegiate Recovery Initiative. And we're doing that through the Recovery Ally training. The Recovery Ally training is a 1 to 2 hour training, depending on the audience, depending on, how much I can dive into the materials. But what that does is it sort of tees it up and it starts it off with some data. And so I talk about some of the current data. 1 in 6 young adults aged 18 to, my little camera isn't blocking my bullet point here. Awkward Zoom moment. Also, somebody just did a burnout in front of my house, if you heard that, so that was cool. But 1 in 6 young adults aged 18 to 24 meet the criteria for substance use disorder. And nationwide alcohol use was linked to 1,825 deaths on campus, as well as 696,000 assaults by students aged 18 to 24. And then more alarming than all of this personally to me is that approximately 97,000 students are victims of alcohol-related sexual assault. And these numbers come from SAMHSA's Behavioral Health Among College Students. It's a great package. You can Google it. It's free online as a PDF. But that's one of the first things we do in the Recovery Ally training is start covering some data and just setting the stage that this is here. And it's something that we need to address, and it's something that administration and students alike need to take a greater interest in, and they have been, which has been amazing. I sat in a meeting one time, and somebody told me, back in the 60s on this campus, we did not have a problem with drugs. And that was amazing to me. I wanted to know, what that guy was still smoking, because it was potent. So that just sort of illustrates just a side anecdote there of like, this is why these conversations are needed. This is why genuine and authentic conversations around these topics are necessary, because it's happening. And I don't think that this is an intentional, pulling the wool over sort of thing. I think that it's just everybody. What I noticed when I started working with colleges is that they are sort of their own community in and of themselves, and everybody's sort of operating in different departments. And one of the goals of the initiative, as a side goal, is to create greater connection on these campuses and create greater collaboration with the state and outside community resources. So just on the mental health piece. Adults aged 18 or older with past year mental health issues were more likely than other adults to report use of illicit substances. So the two are intertwined, and making those connections for the appropriate folks on campus is a really important piece in this. And suicide is the second leading cause of death in youths aged 10 to 24. This is something that's near and dear to my heart, in that I've lost loved ones to suicide, and I've also struggled with suicidal ideations myself when I was an undergrad student. For me, whenever I was in undergrad, I also started doing some contract work with the department. And so I was, again, in a setting like this but it was in person, where the commissioner comes down and she's like asking us, how can we better serve the citizens of Tennessee? And I'm in this position that I've never been in before. I'm in this position where somebody is looking at me like an equal and looking at me like a professional. And I had this huge imposter syndrome where I was like, if they only knew the person that I was, like, nobody would believe in me this way. So couple that with also being an undergrad full time and struggling with finals and struggling with the normal stresses of school, and suicidal ideations became a part of my story at that point. Now, luckily, I was able to find recovery from that, just the same as I found recovery from substance use. But these conversations, the support for these for students that may struggle with this, I think needs to be bolstered, and I think it needs to be built up. And I think that, again, I'm not trying to sound like a broken record, but it starts with conversation. Because at the end of the day, in my opinion, if the conversations aren't being had, it doesn't matter. It doesn't matter what policies we put in place. It doesn't matter how much funding we can get for something if the conversation isn't there. if the landscape is not primed, then the crops aren't going to be, the crops aren't going to grow. So that's the big crux behind the initiative right now, is really starting at the bottom up. And this is just a basic cost analysis of recovery support for students and how it can help in retain tuition, which is ultimately going to be more dollars for the state of Tennessee. And I have some other cost analysis that I kind of get like real nerded out on, as far as as far as contributing to the state as a whole. But I just wanted to throw this in there for you guys to sort of drive home the necessity of these conversations. You can see that, based on the current data, around 4% of students are identifying as being in recovery of some kind on college campuses. So, and I want to preface this following data point: the 1.5% of these students will utilize campus facilitated recovery services. I really had to dig to find that number, just because collegiate recovery as a whole and conversations like this are not, it's still a very much new and growing movement. So the research behind it, sometimes you got to really dig. It can be kind of sparse. Excuse me. But just based on that, a university of, this would indicate that, some universities with like 180 students that would reach out for support. So I did a high, low, medium here, or a high, medium, and low. And you can see the numbers here at the bottom that recovery support could successfully retain or attract anywhere from 2.4 million to around 500,000, based on a university's enrollment. So it's not only, and I always have to preface, just for my own accountability, it's not about the numbers for me. I don't think it's about the numbers for, it's not about dollars for me in my own life, but it's about dollars for the university and stuff. So not only does it make sense from a heart standpoint, which is another reason why I'm grateful to serve with the Department of Mental Health and Substance Abuse. I think it's very passion-oriented and heart-oriented, I think, if that's a word or a way to describe something, team. But it's also, it just makes sense. It makes dollars and cents. And so understanding the initiative, and I've kind of touched on this already, but basically what we're trying to do is start at the bottom of this triangle and build a firm foundation on college campuses to bolster collegiate recovery communities and collegiate recovery programs. And again, that happens through trainings and awareness building efforts. If you guys are familiar with the faith-based initiative, this program is modeled completely after the faith-based approach that Monty has taken and that the state has taken in engaging faith-based communities, going in and connecting them with current resources and connecting them with trainings and opportunities for training through all the various entities that are already doing this work in the communities, like Project Lifeline, Recovery Navigators, Ropes, connecting all the dots. So we've connected a lot of the pieces with the faith-based community, and now it's a matter of connecting universities with the broader community as a whole, and bolstering those conversations within the university community. And I do the triangle just because it sort of stands as a it's a good visual representation of what we're trying to do. The ultimate goal is that students have the appropriate support in place, but that has to start somewhere. And so we're starting at the bottom up, and we're trying to build this initiative in that fashion. Some of the current outcomes from the Recovery Ally trainings and the Collegiate Recovery Academies. So these are campuses that all have Recovery Allies. They've participated in the Recovery Ally training either via an academy or via virtually. And all of these campuses have varying numbers of allies. And they are supporters of the initiative. And a lot of them, if they haven't had an academy, we're working on planning an academy right now. And just to sort of explain what the Collegiate Recovery Academies are, I don't know if this is going to play. I embedded it, so hopefully it plays. Can you guys hear the audio on that?
So UT is taking an initiative that I hope that the whole state will follow suit.
This has never happened on college campuses. This kind of conversation never happened. Oh. In this capacity, we know this is here, and we want to do what we can do to support these students. Individuals you may encounter are not just that person that's sitting in front of you. There's a whole story behind it. There's a whole story that made a person the way they are. And this is part of helping to honor and respect that individual's story and help influence their narrative. You have the power as a recovery ally to influence an individual's narrative in a positive direction. To listen to somebody, just to sit there and listen to them, does so much more than you think it does.
We've all had a habit or hang up that sometimes have the right opportunities to connect with community. The problem sometimes is community doesn't know how to connect back.
Support of like-minded community members is necessary throughout. That's why collegiate recovery is so important.
Individuals in recovery really need that community, especially early in recovery, of others who have gone before them to support them early in their journey.
Addiction and mental illness and suicidal ideation and all of these things are really tough to look at, right?
This is about pulling someone back from the ledge. This is about helping someone to cope in the moment. This is about helping someone deal with what's going on mentally and emotionally with them at the time. This is not a time to change the person's mind on any other subject other than we don't want you to die. We need you to live. We need you to be here tomorrow.
Everything starts with conversation. So having this conversation today is investing in somebody's recovery. Do not underestimate that.
All right. Yeah. And so I felt like, and thank you to Matt Perry, if you're still on here, for putting that video together. It would not have looked that good at all if I did it. I will tell you that. But I felt like that would probably, describe the academies and kind of what we're doing on campus a little better than I could, just to follow it up, and then I won't take up any more of y'all's time. One of the things we're doing with these startup academies, with the initial academy, is we're doing a recovery ally training. And we're doing typically some suicide prevention or harm reduction or trauma-informed care training. And then what's happening after the academies is we're following up with, some follow-up meetings with the faculty and staff that their interest has been piqued during the academy. And we're also working on building these boards on these campuses to meet regularly and talk about what campuses may need moving forward. So just as an example, we're working with Lipscomb right now, which was our first inaugural academy, and we're working with administration and the president's office there on getting a collegiate recovery program started or moved to the next step. So getting the outreach moved to the next step. We've been working on a proposal for that. So just as an example of kind of what the follow-up looks like on those. And I think that is all I've got. I'm awkward at endings, so I'm just going to leave you with this picture of me and my contact info. If you guys have any questions or anything, I'm here to answer them. I appreciate all the emojis and stuff. It's really been helpful.
Do we have any questions? Please put those questions in the chat box. Nathan, man, you're the right person for the job. It's impressive. We salute you in what you do, and know you'll make a significant impact on those college students. Look forward to it.
Yes, sir. I appreciate it.
Hear from you soon too. Okay.
I appreciate that.
So to all members and those present, those who may have questions for Nathan, please enter them in the chat box. At this time, I'd like to first thank all the presenters, the guests and members who joined the Planning Council's meeting today. Thank you to the Commissioner, Deputy Commissioner McNancy, Assistant Commissioner Kirk Hipple, and all, and especially we can't leave out Kirby and Avis and Amy for their efforts to put this together as they do every meeting and make me look good on camera. So I appreciate you guys for all that you do. Our next scheduled meeting will be Tuesday, June the 14th at 10 a.m. We'll do it the usual way for now because of COVID. If there should be any changes, we will notify you ahead of time. I need now a motion to adjourn. Please put that motion in the chat box. That motion has been made by Wayne King. Okay.
And Jan Cagle seconded the motion.
Okay, so we have a motion, a second. All in favor?
Aye.
Let me go back. I'm sorry. You know, we got to do this a little different. I believe Kirby has to now.
No, we don't have to do that for the ending the meeting. It's only for votes.
Okay. All right.
No worry.
Okay. So the ayes have it. Thank you again. We look forward to seeing you next meeting, and be careful and safe out there. Have a good day.
Thank you, guys.
Thanks, Albert.
Thank you.
Everybody.
Thanks, Albert.
Thank you, Nathan.
Everyone.
Thanks, bye.